Welcome, namaste. My name is Natalie Sari. I'm a kinesiologist and physiologist, and of course a yoga teacher providing the therapeutic benefits of yoga. Today it'll be a little different. Rather than talking about pain and injuries and anxiety, we're going to talk about somebody other than ourselves, and that is babies. So this is for all you pregnant mamas, and I'd like to share a little bit of insight about yoga and its benefits for pregnancy, primarily for during your pregnancy, second, third trimester, but also just some of the things to consider when practicing yoga or any type of exercise when you are with child. If you have any pre-existing conditions, such as heart disease, lung disease, severe anemia, difficulty breathing, if you have had any issues with a previous pregnancy or you're at high risk with this pregnancy, if you have any significant changes in your health in the last little while, definitely check in with your healthcare provider, your midwife, your physician to ensure that this will be good for you. From my own experience, exploring yoga in a different way as my body transformed, I quickly realized that some of the things I used to do weren't really working for my body now. So be really open to the transformation in your body and honoring it for what it is. Providing yourself with the right type of practice that suits you in the moment, which will change every single day. There are many benefits to exercise and yoga practice while you are pregnant. Obviously, it helps to maintain your fitness level, to reduce your risk for things like hip and back pain, to open yourself up to prepare for delivery, to help elevate your mood and keep you feeling energetic and good throughout all of these changes. And it can help you postpartum as you're going through that process as well. One of the most important things that I have found the yoga practice to benefit me is the connection to the baby. If you're newly pregnant, if it's your first child, this whole process is new, and you may be used to exercising just for you. And many of you may have already had a really strong yoga practice. So it's important now to remember that it isn't about you anymore, that it's about this little being, and honoring the whole change of what's happening throughout your pregnancy, connecting to the baby and taking those moments to stop and appreciate all those little wonderful bits, even the uncomfortable ones. I know many women suffer from shortness of breath and fatigue and swelling of the feet and lots of punches and kicks throughout many months of pregnancy. So when you're practicing yoga, I'd like you to start first and foremost by taking a moment to connect to what's happening inside of you. So let's begin our yoga practice with our babies. Please take a comfortable seat. It could be on a ball. I don't know if you've noticed as your belly has grown, as you've progressed along the pregnancy, that things start to get a little uncomfortable, especially in seated positions. So if you're sitting up on a bolster or something like that, it can be really nice, or even sitting in a chair. But I know many pregnant women are using the ball in preparation for labor, so you could incorporate this into part of your yoga practice. So we'll start off here. Get comfortable. So position yourself so that the pelvis is central over the ball. And as you know, your center of gravity has changed quite a bit. So it'll almost feel like you're shifting your hips back slightly. The pelvis nice and open over the center of the ball. Your feet much wider than hip distance. We'll take a moment to connect to the most important piece, the baby or babies. Close your eyes. Take a deep breath in through the nose. Exhale out the mouth. Continue to deepen the breath, lengthening the inhale, making the exhale even a touch longer. And you may notice your body naturally starts to relax just simply by lengthening the breath. Draw your attention down to your belly, your uterus, the little being within you. And see if you can connect to its heartbeat. Many of you have probably heard it on the Doppler. And see if you can connect to your baby's vibration. You are so connected to this little person already. It can feel every little bit of you and relies on you for nurturing, loving, support. Take a moment to tell your baby that you love your baby dearly and that this practice is for the both of you. And you may even have a specific intention for your practice today. It might be, today I really want to relax and calm my body and my baby. Or maybe it is the opposite. It could be, I'm feeling so exhausted. Today I need to energize, reawaken as I connect to this little being. So when you start your practice, if you decide to do this practice over and over again, set a different intention based on the day. And take that time to connect before you start. Then you may start moving. If you're on the ball, you could move around in a circular motion. If you're sitting on a chair, you can simply move your hips a little side to side in the chair. If you're sitting on a block, you could do the same thing, sitting on the floor with your legs crossed or legs straight. Take a few moments to stir up right from the center, from the baby, so that you're starting from this very special place. Some things to consider when you're practicing yoga or any exercise is that you might have some signs and signals of discomfort and some that could be quite significant. So just pay attention if you feel really short of breath. Shortness of breath is common in pregnancy, but often, well, as the baby gets bigger and presses on the diaphragm, there's less room. Also, just changes in blood volume. We're holding a lot more blood in the body. So if you can move slowly, transition slowly, especially when you're lifting your head, lowering your head, sitting up, moving to the side, just being cautious with your movement. If you feel anything throughout the practice that doesn't feel right, like chest pain or severe pain in your legs or anywhere in your limbs for that matter, if you notice that you are feeling absolutely exhausted and fatigued, then certainly speak to your provider. Let's start with a little bit of movement through the thoracic cage, so bringing it more to the ribs. So start to breathe a little deeper, fuller breaths, expanding wide into the ribs. And as you exhale, let it go. The ribs can get pretty sore. Breathe in again here to the ribs. From the expansion, they're actually moving to create space for this baby, and you might even be getting kicks and pressure from the baby itself into your ribs in the later months. I'm now in my last stretch, 4 weeks to go. Breathing into the ribs, grow a little taller and longer for one more breath. And then add a little movement, starting to twist to the side. So you can keep your hands here floating, or you could take your hands to opposite elbows. Gentle twist, very, very important, because twists, one, we have less room. Two, if we twist too far, it creates a lot of pressure in the torso around the baby. So just gentle twisting, little hugs as you move side to side. And then let's bring it up a little higher now, more into the neck. So you could even release your arms down by your side. Start to move your head over to one side. Chin down towards the chest. All the way over to the other side. Be gentle with the neck. Slowly release. Over, opposite side. You might even stretch your fingers slightly further down to lengthen the trapezius. And over to the other side. Back down. Allow the head to hang for a moment. Allow your body to round slightly. Slide your hands onto your knees, and as you inhale, lift the chest, lift the heart, gently extension in the spine. Exhale, tuck the chin round the spine. So this is your version of cat-cow in seated. Seated flexion, extension through the spine, creating mobility. Just be careful when you curl in. Inhale to lift. Exhale to draw in. Simple, gentle breathing. No strong breathing practices. Just nice, steady flow of breath. Last one. Sitting tall. Reach your hands back behind you and reach out through the fingertips. So now into the shoulders, arms, fingers. Inhale, reach all the way out and reach up overhead. And you could look up or look dead ahead, whatever's more comfortable for you. As you exhale, reach back out to the side and down. See if you can keep the shoulders away from the ears as long as possible. So you reach out, and then at the last little bit, they might lift slightly. As soon as you lower your shoulder, or your hands, your shoulders draw down away from your ears. Good, one more. Maybe reach a little bit further back. You may have noticed through your transformation that your body has become a lot more open. There's a release of relaxin. We'll do some shoulder rolls next. Relaxin hormone in the body, which allows your ligaments to lengthen. Normally the ligaments don't lengthen when you're not pregnant. So this is in preparation for pregnancy, obviously, but there are certain joints that are not intended to become more mobile, like your knees and your shoulders. So you just want to be gentle with this when you're practicing, not to go to full end range of motion or to overstretch. We'll focus a little bit more on strengthening, if anything, and opening the parts that need to open for the birth. Good. Take a deep breath, reach both arms up overhead, interlace the fingers, gently press the fingers up and away, and then lengthen into the side of the body. So you could keep your elbows a little bent if that's more comfortable. You could also hold a towel between your hands if that's better for you. Start to lean a little bit to the side and stretch the side of the body. Inhale, come back to center. Exhale, over to the other side. Inhale, center. Exhale, side, perhaps lean back slightly. Up and over to the other side. Back to center, draw the knuckles forward and stretch in between the shoulder blades. Slowly release your arms. And pause for a moment. Connect back to this little being. Take a deep breath. From here, we'll transition to standing. So if you're on the floor, take your time standing up. If you're on the ball, you can stand up. As you arrive to standing, you might feel lightheaded. It's been my new experience to feel those symptoms all the time when moving from seated to standing or from lying down to seated. So take your time when you arrive to standing always. Have a wider stance for your feet, wider than hip distance. You might even turn the feet out slightly. Create space. Vinyasa, sun salutations, you can say goodbye to them for the time being. You can reintroduce them after your pregnancy. But there's lots of other wonderful flows that we can do while we have this belly full of joy. So we'll start off standing. Just take a moment to stand tall on your 2 feet and feel your new center of gravity, which is changing every single day. Shift a little weight forward and back over your feet. And notice how you have changed today. How do your feet feel? Are they tight? Are they puffy? Connect to your feet, ground down, activate your leg muscles. They might feel a little tight and sore as well. Bring your awareness up a little higher into your pelvis, into the hips, and of course you'll notice loads of changes happening here. Pelvic floor, that we could have a whole episode on, but we'll just start by drawing the pelvic floor in and up, and this is subtle. This is a practice many of you are probably doing every single day, should be a little bit, connecting to that place, drawing it in and up so that you don't lose the ability to connect to that, but not doing it too strong, mind you. As we move higher up, the core muscle transversus abdominis, you might have noticed you've lost this ability to contract your abdominals and your core. It becomes very faint, and we don't want to be doing a lot there anyway. So have that part be very subtle, very, very subtle, hugging. Next, notice your tailbone and your sit bones, and that has also changed quite a bit. So move a little bit into those places, a subtle tuck of the tailbone. Not too much, as many of you may have heard that with this new change of weight forward, it often pulls a woman's back into this position. If we simply tuck the tailbone, it doesn't necessarily solve the problem, and it can bring your pelvis into a misalignment in itself. More or less finding a neutral that is going to change for you all the time, and think of rising up a little bit taller through the ribs to create space. So let's do that next. Start to move up a little bit higher, draw yourself up high. A little lift of the sternum, a broadening of the collarbones, and then your arms, you can let them fall down by your sides now. So this may be your mountain pose, very different, and will continue to change. Take a big breath in, reach your arms up overhead. Exhale, float the hands down through the center line and honoring this wonderful little being as you travel down. Bend your knees, inhale, reach up overhead. Exhale, hands draw down. One more. Exhale, hands come down. Although some of you might be really comfortable with folding, it'll only get more uncomfortable. So bend the knees, slide your hands down your thighs, and you're basically in a really wide squat. Take a big breath here, and you may drop down to your elbows. If you'd like to go a little bit lower, you may draw your head down too. This is a nice place to be, very little pressure. Take a big breath in, hands on the legs, lengthen the spine, press through your legs and rise all the way up to standing. Slowly release your hands. Repeat that again. Inhale, reach up overhead. Exhale, float the hands down. We'll bend the knees at the same time and come into the fold. Inhale, lengthen halfway. Exhale, you could even pause here. Coming up when you are ready. You may notice that you'll need more time with these transitions as, well, depending on the day. One more. We'll reach up. Exhale, folding, gently bending the knees. Come down, let your head and neck release. Inhale, lengthen. And then as you exhale, turn your feet out a little bit and come into a squat. So we'll keep it as a wider upright squat for now. And as you're in the squat, move around a little. Now, some of you will have maybe more flexible ankles, Achilles tendon. Mine are quite tight. So if your heels lift off, that's okay. You don't have to force them down. None of the practice should be forced. We want to keep it comfortable. Caution any knee pain. Just make sure that you're being safe in your joints. Take a big breath in. Rise all the way up. Exhale, hands come back down. The goddess pose. Bend the knees. Sit back down again. Elbows on your knees. We'll try to keep this nice upright spine, rising up and opening the arms like so. Take a big breath here. Exhale, tap the elbows to the knees. Inhale. Exhale, tap. One more. Exhale. And then relax. Slowly lower your hands down to the floor. Turn your feet out and take a nice wide angle with movement. And this might be one of the nicest forward folds that you can do in pregnancy, staying a little higher, or even taking a block or two and using that for support. Let the head and neck go. Slowly slide back. Use your legs to rise all the way up. Exhale, hands float down. Reconnect. From here, we'll move into Virabhadrasana, the warriors. Step your right foot out to the side, your left foot perpendicular, so your heels line up, one out to the side, one forward. Nice wide stance. Bend your right knee, support it over your ankle. You may not go into your deepest warriors as you used to, and that's perfectly okay. Take a moment to move a little up and down, connect to your pelvic floor, draw it in and up, lengthen the side of the torso, expand out through your arms, reach out through the fingertips, take a nice deep breath. Again, it might be more comfortable to keep your eyes open if you're finding that your balance has been a little bit off, because we want to reduce our risk of tumbling, of falling. Looking to your right hand, to the very tip of your middle finger. Soften through the shoulders, widen across the shoulder blades, as well as your collarbones. So both sides nice and open. Deep breath in. Good. Exhale, release your arms. Move over to the other side. Turn your right foot in, left foot out. Bend the knee. Try not to go with your leg. Keep your torso nice and tall, side body long. Exhale, reaching out through your fingertips, gazing sharply at the tip of the finger. Soften any parts of you that don't need to be fired up, like your forehead, your jaw, shoulders away from the ears. Take a big breath. Exhale. Inhale, rise back to center. Turn the feet back to where you just were. Bend the knee. If you have a block, they're super handy for this next pose. So we could take it somewhere in this range. If you don't have a block, we'll just simply use the leg. Straightening the leg, but not fully, because we want to caution overstretching the knee joint, as I mentioned earlier. So you'll slightly bend the knee and pull up as if you're lifting your kneecap. Arms extend long. And this time, allowing your body to shift. So you'll reach as far as you can. Other hand could rest on your hip. Right hand slides onto the leg somewhere, or perhaps onto your block. You could even be on a fist if you want a little bit more height. Gently leaning back, opening the chest, shoulder, side, body nice and long. You can keep this hand here. You could take it to your low back, or extending it up for full expression of Trikonasana, triangle pose. So this is perhaps a softer version from what you've practiced before, and that's absolutely wonderful. Take a big breath in. Exhale. Gaze down, it'll help with balance. Take your hand back to your hip, bend your knee, rise back up. Turn the foot in, turn the other foot out. Let's pretend we didn't have a block, so we have to use our own body for the other side. Soft bend of the knee. Extend the arms out. Reach out through the left hand, so the whole body shifts. Other hand to hip, other hand slides somewhere along this leg, and then rolling the shoulder back, pressing out through your back leg too. If looking up is not comfortable, looking somewhere dead ahead, it may be more comfortable for your neck. Perhaps this side you do something different, your arm to your back. Open the chest, gently lift the heart. Nice deep breath. You may even find at some points you bring your hand back to your belly and support. Big breath in, reach up. Slowly come out, look down. Use the breath to transition. Big inhale. Exhale, release. Start to walk your feet in, and we'll prepare for our balancing pose. The tree pose, really important to remember that balance is not the same. So you can certainly go to a wall and just have your hand or your finger against the wall if that helps. Rather than lifting your leg up all the way, you can take it to your calf, so it's just below the knee, and focus on the beauty of the pose and how grounding it is. Take a moment to connect to one spot dead ahead of you. Use that as your drishti, your point of focus. And a moment to slow the breath down. You may even keep your hands on your belly for tree pose, Vrikshasana. Lengthen the breath, deep inhale. Exhale. Sending love and goodness to your little being in your belly. Notice that your balance is not nearly as good as it used to be. It's just so common. You're holding so much more weight. The blood, the breath, everything is different. So let yourself be wobbly. Take one more breath. Reach your arms out and up. Full inhale. Exhale, release your arms, release your leg. Feet both return to the ground. Pause for a moment. Feel, notice even with your feet close together, how it is a little harder to stand now that you have this change of weight in the front. Take a big breath in, reach your arms up overhead. Exhale, hands float back down. Good. Reset for the other side. As you set it up on the other side, find drishti. It's really important to make sure that you're stable and you feel safe when you're balancing, because we are at a greater risk of falling with this change in weight. So use the wall if you need to. Have your foot a little lower. Deepen the breath. Inhale. Exhale to release. Lower your arms, lower the leg. Again, bring your feet together just to feel that. Squeeze them together. Close your eyes for a moment and open them. Good. To move to the floor, we'll separate our feet. Take a big breath, reaching out and up. Exhale, hands float down through center. Bend your knees. Fold. Gently let your head come down. Inhale, lengthen halfway. Good. And as you exhale, come into a deeper squat. So you could roll something up under your ankles if you feel like your heels are starting to peel off. You could have a block or something in front of you for your hands, or you could take a little block behind you and just lightly sit on it if that is more comfortable. Knees will gently open out to the side, hands together at the center of the heart. You may even close your eyes, but it is nice to have them open. As you take the next couple of breaths, feel the hips opening and allow the pelvis to sink down slightly. Bring both hands down to the ground. You can tip your weight forward a little bit and then come down carefully. Bring one knee down at a time so that you're on hands and knees next. Being supported is really important in prenatal practice, so you may have lots of props. We can use them for all different things. I'm going to use the blanket for the knees. You could spread this out across your mat for more support. Starting off on hands and knees. Knees as wide as your hips, maybe even a touch wider. Fingers spread wide under the shoulders or slightly forward. Being on all fours may be one of your most comfortable positions right before birth. So this is something to practice during the months leading up to it. As you let your belly soften and relax, it can also help the baby to move into its position for descent. So if your baby is turned and not positioned anteriorly, this can help it to get into position. So when you get onto hands and knees, start to move a little bit and relax your belly. Relax it, no core engagement. Move a little bit side to side, move through the pelvis. You could even move a little bit into your shoulders, maybe even into your neck too, and you move all parts of you. This may start to look like cat-cow as you push up a little, come down a little, but again, just caution not to draw the navel in and engage the core strongly. As you loosen up your body, deepen the breath. You might even notice the breathing rate changing in this position just from the pressure of the uterus on the diaphragm and from the motion. Good. Slowly start to shift back into your new child's pose. So your knees may be a lot wider. That will help with opening the groin muscles too. You could keep it so it's more active at first, so you're pressing with your fingers. Your head may not reach the floor, so you could have a block that you place your forehead on and keep yourself a little higher up so there's lots of room. Deep breaths. Slowly walk yourself back up. At some point, child's pose may not feel good. It's starting to not feel great for me too. And if that's the case, you could stay up a little higher and even have your toes curled under and just lightly pressing and moving. The other option is, as you've taken out downward facing dog from your practice, is doing what's called the puppy pose. So bringing your elbows or your forearms onto the ground. This is also a really nice position during the preparation for birth, creating space. The shoulder, your wrists and your arms can relax and the weight is more distributed across the forearms. Movement here, keeping your hips high above your knees so they're stacked, and you could even slide yourself out a little bit and your forehead might reach the floor a bit easier here as your heart melts. There are some other forms where you can bring your chin a little bit further forward, but you're probably going to find that being uncomfortable too, so just let your body fall into a place that feels comfortable. Deep breath. And then slowly come out of that, walk yourself back. We could be doing some twisted versions of that pose, but it's usually nice to stay a little more upright because we're not getting into those deep twists. So feel free to take one arm across and find the stretch by drawing your right hip back. And then the same on the other side, reaching it across with a little pull back of that hip. You may find a lot of your practice feels better with some subtle, gentle movement rather than being static all the time. Come back up to your hands and knees. To add a little bit of stability and strengthening, a wonderful practice is taking the leg back. You may have practiced this before, but to practice stability so that you can feel where your body is in space, you can take a block and balance it just above your hips, giving you that awareness of where your hips are in space. Make sure to keep your upper body solid, space between the collarbones, ear to shoulder. Start to take your right leg back behind you. So you'll notice if you start to tip a little, the block might fall to the floor, and if you lose it, don't worry about it. Just bring yourself back. Press the leg back behind you. There it goes. And then slowly release. Switch to the other side. Press your left leg back. And then you might have to draw the hip down a little bit. So that'll be your indicator. If you keep it up high on this medium level, it's a bit harder to balance it. Take one more big breath. Exhale, release. And then do one more on each side. Right leg. For added challenge, you could take your left arm to opposite arm to leg. Slowly release. Switching sides. Left leg. Right arm. Big breath in. Exhale to release. Good. Child's pose again. Perhaps come down to your forearms, stack fist, rest your forehead there. At any time, if child's pose isn't feeling good, you can come up to Virasana or hero pose and pause on your knees, closing your eyes, connecting back to the belly. Good. Coming up onto your knees, slide the right leg out to the side. Gate pose. So with this posture, we're lengthening the side of the torso, creating space where we need it and in the ribs. Slide your right hand down your right leg. Your left hand could stay on the side. You could reach it up to the sky. You can also take it to the back of your head, which I quite like, resting the head into the support of the hand, lifting up and over through your elbow. Big breath in. Exhale. Don't worry about reaching all the way down. Just go to where it feels comfortable, almost as if you're lifting up rather than sinking downwards. One more breath. Good. Use the next inhale to lift you back up. Take your hand to the floor beside you, and this would be your version of side plank. So have your arm right under your shoulder. Your other leg could lift off if you like, or you could keep it on the floor somewhere. Other arm reaches up and over. So you could use this to help balance your weight. You could even play a little bit with movement. Open the shoulder. Take another deep breath. And as you exhale, slowly sweep yourself back to your knees and pause there. Big breath in. Exhale. Come back up to your knees. Slide the left leg out. Sliding your left hand down your left leg. But first, lengthen up through the torso, side body long. Exhale, lean. You may take that hand to your back, your side, maybe extending it up. Perhaps the back of the head, cradling the skull. Breathing into the right side body. A little more breath into the right lung. Good. Reach up, reach over to the side, hand to the floor. Left leg can stay on the ground. Left arm could be up or over your ear, or you could lift your other leg. You could play with movement if you like. Feels so nice to move and explore the body. Couple of deep breaths. You'll sweep yourself back when you're ready and come back to your knees. Hands onto your baby. Big breath in. Exhale. Moving to seated. Sitting on something for sure. You can sit on a chip block if you enjoy that, if you have one. But a blanket works really nicely. Folding it up slightly so you have something to prop yourself up on. So one of the most common seated postures I have found in the many different prenatal classes that I was able to attend, lots of wonderful tips from many teachers through my first experience of prenatal yoga, was this pose. But I found this to be the most uncomfortable pose, and it was triggering some really significant sacroiliac pain, sciatic nerve pain. So if you ever feel anything sharp or shooting in your hips or down your legs or anything, then certainly don't do that. Today is a better day for me, so this is somewhat approachable, but anything leaning forward is just not working. So taking your hands behind you onto your fingertips perhaps, and lifting up through the chest is really, really nice. Let your knees open up naturally without any force. Let your belly be free. Big breath in. Good. Slide the right leg out to the side. Left leg can slide in. Now, we want to avoid any pressure or deep folding or hammocking, leaning back where the baby is in that forward folded pressured position. So keep that nice length lifting up through the torso. Lean a little bit towards that right side, but don't go down or go for the foot. Just keep it a little higher up and open your body to the side. Your other arm could reach up and over. You could play with reaching back, taking your arm behind your back, opening the chest and the shoulder. Slowly lift yourself back up, and rather than folding over your foot, a gentle twist. You rotate, opposite hand to leg, gentle twist over the leg. And maybe you stay much more upright than normal, twisting gently. Big breath in, unwind, and then release. Other side. Take your other leg long, other foot draws in. Sit nice and tall to start. Dip your elbow towards the leg. Another nice option sometimes is to have a block. You could take it a little higher up if you need some support. Other arm can reach up. Feel free to play with different positions. Arm up overhead or arm behind your back is a nice version. Even one hand on the belly. Big breath in. Exhale. Inhale to rise up, and then again adding the twist, opposite hand to leg, other hand to the floor, and start to twist a little. Gentle twist. Good. Slowly unwind, and both legs, extend them out. So we can use the blanket to help tilt the pelvis forward a tiny bit, or lift yourself up a little higher if you'd like more support. It just feels better rather than having it scooped under. Lots of space for the belly. Take your hands to your legs and start to move a little side to side. Especially if you are a bit tight in your hamstrings, some gentle movement first can feel really lovely. Good. Come back to center. Take a big breath. You can either slide your hands down your legs, but what's really nice, since we are staying more upright, is to use the block and take that in front, and you can lean your elbows on it. You could take it up a little higher. If you're getting into a slightly deeper fold, maybe walking your hands out and having your forehead on it. But remember, we're not trying to fold deep. So go to where it feels comfortable and spacious, where it feels really good for you. Lots of room for the belly. Take one more big breath in. Exhale. Inhale to rise back up. Reach your arms out and up. Exhale, hands float back down. From here, we'll move to the floor. Start off on your back with your knees bent. A moment to pause. Gentle movement with the legs. The hips can rock with the help of gentle swaying motion of the legs. A massage across your pelvis. You may feel the bony processes of what's called the posterior superior iliac spine of your pelvis. They've grown apart from each other and may feel a bit sensitive around the SI joints too. Supported bridge pose. Your feet hip distance, but maybe even a bit wider. Your feet don't have to be all the way back either. Grabbing a block, pressing firmly through your feet, sliding a block underneath, and have that subtle tuck of the tailbone or sliding up your mat slightly. And you might find this in itself to not be super comfortable these days. If you start to feel short of breath or pressure or any discomfort in your belly, then please come down. But this may be, just felt a little something. This may be your version of bridge pose for the next little while. Feel free to let your pelvis ground down into the support of the block and caress and hold your belly. Deep breaths. Very carefully press into your feet. Rise up just enough to slide the block out to the side. Come down super slow and perhaps create mobilization through the spine where you press your upper back down first, rolling down, tailbone touches last. Feel free to do that more than once if that's feeling really nice for you. Pause once you reach the ground. Walk your feet out a little wider. Arms out a little wider too. You could have them down or turned up. Legs float over to one side, up and over to the other side. Now gently mobilizing through the hip socket, the acetabulum, the femur head of your thigh bone, moving around in the hip socket. Good. Bring your legs back to center. From this place, letting your knees fall out to the side may or may not feel comfortable. Taking one or two blocks and sliding them under your knees is pretty nice, but many of you might find that laying on your back, maybe even earlier on in your pregnancy, just does not feel good anymore. And it can be because of the pressure on the vena cava that supplies blood and nourishment from the heart to the body. So you might find coming into a slightly reclined position is more suitable. So you could take your bolster and angle it so that you're sometimes even sitting up on something a bit higher can be nice here. And then having something under your knees or using your hands, two fists, to rest your knees on can be really nice. And that already feels better. The head slightly above the heart. Belly relaxed. Legs can open. Whole body supported. But we're not overly flexing on the belly. We're not reclined to a full supine position. We're right in the middle. This may be more of your relaxation pose once you're getting to that phase in your practice. You could even do this at the end of the day or right before bed. Big breath in. Slowly release your legs, slide them out. Give them a little shake side to side. Bend the knees, roll onto your side, support your head. You might come up onto your elbow to start. And come down onto your side. Using your arm as a pillow, your Shavasana position may look more like this. And using a little something between your knees can be really nice. You might already be sleeping this way, keeping the space in the pelvis, support here. And sometimes I even like to tuck a blanket a little underneath the side of the belly, giving it that space and support. Take a moment to connect to your baby as you close your eyes and settle into your version of Shavasana, final relaxation pose. Moment to honor this little being. Connect to it, speak to it. A wonderful time to chant sweet lullabies to your baby. And even the nice hum of your breath, the vibrations you emanate just from being you. The baby has gotten to know you very well and will continue to do so throughout the last stages of the pregnancy. Slowly, meaning super slow, slow motion, begin to move. You may remove what's between your knees. Lean your weight towards your opposite hand, separate your legs. Rise up carefully. You may feel a little lightheaded as you transition. Sliding into a comfortable seat, maybe you sit up on something. You could have yourself in a cross-legged or sitting up against the wall for a moment. Take this time now to close your practice. Repeat your intention one last time. Notice the calmness within, the results of your practice affecting not just you, but this little being within you. Thank you so much for joining me today, and I hope that this provided some helpful tips and tools of how you can play with your own individualized yoga practice, connecting to your baby as you change and transform together. Namaste.